because I was a big, back in the day, psychologist, psychiatrist, nobody can help me. And when this happened, it just kind of stopped me dead in my tracks. And I said those first couple of months, how can I get through it?
Why are you here today?
Here today because I have had tinnitus for over a year, and in everything that I've read, and I've been on your websites, and I've met with Dr. Ramsey, I think that TRT training and sound therapy is my final move to getting this fixed, because I've been down a lot of routes. This past year, I see a CBT therapist, so she's helped me in the beginning a lot. I would say, honestly, I know the whole idea about CBT is, put it in the back. We don't want to hear it anymore. We want to bury it. I'm a very hyperactive individual with a very dynamic personality. So that was very hard for me, but she became really my kind of like psychologist and therapist, because in the beginning it was really, really hard. And I think what I learned from her most was the breathing exercises. That's what got me through the first couple of months, and learning how to breathe the right way. People would say you got to breathe in, through your nose, and then exhale, and listen to meditation. She did a couple of tapes for me. I have an hour and a half trip in and out of the city. So going into work, I listen to it, and then coming home, I listen to it. And if I had a lot of anxiety or I was stressed out, I would just tell my family, like, I got to just go lay down, and I listened to it for a half hour, and that would kind of get me through. So that's what I feel about therapy and how it could really help you, and how it helped me, because I was a big, back in the day, psychologist, psychiatrist, nobody can help me. Breathing, and why does that help you? How can it make me feel better? Well, it does, and it helped in bad times.
Thank you for sharing that, Tom. Hey, just a quick interruption. Do you live in Northern California? Because on May 9th, I'll be in person in San Francisco for a live Treble Health event. As you can see on the screen here, our last event in New York City was such a success. So I hope to see you there. Check the link on the screen right now where you can reserve your spot in San Francisco on May 9th. I really hope to see you there. Let's go back though. Let's go back to perhaps when the symptoms first started getting intense for you. And perhaps also today, what exactly are you hearing? Is it one ear? Is it both ears? Is it a ringing? Is it a hissing? Does it come and go? Is it constant? Tell us more about your experience.
I got COVID in November of 23. And then in January, I started hearing a hissing sound just in my left ear, one ear only. But it wasn't bothering me. I wasn't really thinking about it. But then it got a little bit worse. And then I started talking to people. We have some ENT friends, and everybody's saying, yeah, they're starting to say that maybe COVID. They're not sure, long COVID. It'll probably, go away. Hopefully it'll go away for you. Well, mine continued to get worse. The hissing got louder. The frequency got a little bit louder. So I went to an ENT. That's a good friend of mine that I know for a long time that treats me for reflux. And he told me, and what everybody says the ENTs are going to tell you, if there's nothing I could do, you're going to have it the rest of your life. Try to see a CBT therapist just to get some therapy, but there's nothing I could do for you. So that's it. I then went to an ear doctor and had a hearing test. And, I'm 56 years old. He says you have very, very minor hearing loss in your left ear. But I wouldn't really consider it hearing loss. So I don't know what that really means or doesn't mean. So I don't know how that helped. But after that, I then went the route of, because somebody was, I don't know how I found out, but because I was able to maneuver my jaw, and people said it might have to do with TMJ.
Understood. So just to set the scene, you're describing so far some possible reasons for why this started, right? Okay, I got the hearing test. It showed it's not perfect. Does that explain the whole picture? Probably not.
Right.
There's a potential jaw issue going on. Let's get it evaluated. They diagnose, hey, something is wrong with the jaw. So that makes us wonder how much of the tinnitus is related to the jaw. Do you feel like you have an answer to that question?
I don't, and it's been really hard because the oral devices, you're supposed to use them for months and months to get your jaw back in line. He also then sent me to a myofascial therapist, where I went, and she would get into the muscles inside my mouth and try to stretch, whatever she could out to try to bring the jaw down. I saw her for 6 months, and I didn't have any results from that. That lasted significant enough that I would say she helped me. But that's the course, right? He did an analysis. Sure, you have tinnitus, your jaw leans, maybe a therapist can help. My oral devices didn't work. Do I still think that's the cause of it? I don't know. I spoke to some other people that got it from COVID. I mean, I got COVID in November, and then my symptoms started in January. The biggest thing for me, to be honest, if I didn't have ear pain, I'd be habituated and done with the tinnitus, because my tinnitus is pretty low. But when you're trying to put it in the back of your mind, and every day you get ear pain, it's just a trigger that says, here comes the tinnitus. So that's why the ear pain's been, it's, all the doctors really can't figure it out, except that it's got to be a TMJ. I've gone, like I said, I had the MRI. As you guys all know, the ear doctor can only see a certain.
We can only see to the eardrum.
Correct.
And most of the hearing mechanism happens
behind
the eardrum.
Correct.
Therefore, if we get an MRI or a CT scan, imaging studies, we can get a better picture of what could be the cause of tinnitus in some cases, or at least how is the whole hearing system working. Did you get advanced testing like that?
No, I didn't get any on the back of the ear.
Yeah, behind the eardrum.
No, I didn't.
Most of the time it's not necessary. I was just curious.
Well, it's funny you said that, because I went to Dr. Cohen in the city. He's a very good otologist, and I asked him, I said, can you look at the back of my ear? And he told me, 98, 99%, just go see Dr. Gill. It's TMJ. I can't do anything for you. Because I asked him, could you see my eustachian tube? Should we look at the back of the ear, the middle ear? Maybe it's fullness. Is it ear pressure that I'm feeling?
And when you have a symptom of pain, it could be related to TMJ, but it also could be something else, another ear condition. Would you mind elaborating on, does your tinnitus fluctuate? And is it equally in both sides or mostly in one? Just review the actual symptoms, because this can sometimes give us clues to the confidence of a diagnosis of TMJ as a cause of tinnitus. There are times when someone frankly just has TMJ. It doesn't necessarily have anything to do with their tinnitus.
Correct.
Which I'm sure you've...
Well, when I went to the TMJ doctor, I don't click, I don't pop, I don't grind my teeth. So I don't have TMJ. I have what they call TMD.
Got it.
Right, which is a temporal disorder.
Temporomandibular joint
Yeah,
disorder.
yeah.
So we have the temple and the bone there, the mandible, the jaw. Those are both bones. How are they, held together by this joint? So sometimes it can be out of whack, and that's commonly referred to as TMJ.
Right. I do have it all the time, but it does fluctuate. I have good days and I have bad days. The stress 100% exacerbates it. I was talking to Steve. On a hot day, you're doing gardening work, you bend over, or I work out and I'm running around, and it definitely gets worse as my heart rate is elevated.
And how much does your tinnitus fluctuate throughout the day? Talk to me about, if it's not constant.
Yeah, when I'm busy at work, like everybody else, I don't hear it. Unfortunately, I have an office that doesn't have my private office, we don't have any people in there anymore, so I sit by myself.
It's very quiet.
Very quiet. So I like to really be on the floor a lot and to be out in the open. Because when I go in my office, unfortunately, psychologically, it's just been an automatic trigger. I know when I go in my office, it's going to start. And I sit down and I'm waiting for it, right? Which you're not supposed to do. We all know. And it gets a little bit worse.
Yeah. Anyone else here feel that they've made some progress in their ability to concentrate during the day or focus on work? Just raise your hand. I'm just curious. There's a few folks here who that'll be an interesting conversation of.
Yeah.
I'm sure you have some insights as well.
I'm the director of food service. So when I go for AIG, so when I go into the kitchen and the hood's on and I'm talking to the chef, I could stay in there all day long.
No tinnitus.
I'll never hear it.
Let's go into what you've used that has helped. So, we can start with some of these, some of these more lifestyle changes or self-guided practices, like you mentioned earlier. We can also bring in more medical devices or physical objects or, sound therapy, bimodal, whatever you tried that has helped in your opinion. Would you be able to share?
So I definitely chased very expensive technology, very expensive doctors in the city because I wanted it to go away. Just go away, and then that's it. And now I realize that maybe it's not going to go away, but now I'm okay with that. My problem is the daily pain. In my ear. That's really what drives my, and I've told the doctors that, if you could get rid of my ear pain, I feel I'm habituated already, but I can't with the pain.
Yeah.
That's the only thing that drives me right now.
Yeah. And generally speaking, pain in the ear is a medical diagnosis and a medical treatment path. So that means the ENT physician, the ENT doctor, what you refer to as the otologist. So I know many times it can feel like I tell them everything that's going on. They don't know how to solve it. They want to solve it, but they haven't yet solved it. So
How do you get the back of the ear looked at? How do I get my middle ear, Eustachian tube, auditory canal, and all that looked
Yeah.
at that I've been wanting to?
Yeah, essentially advocating for imaging study behind the eardrum is how that test could be ordered. So, the reason that we don't recommend it to every patient is because it's rare for it to come up with something, and in the medical system, we can't be recommending an expensive test to every person, right? However, if your case has prolonged where it hasn't gotten better on its own, then it does bring us into this phase of wondering, okay, what further testing can we do? There's a small chance, but there is a chance that there's something physiological going on that could be explaining the pain. And yeah, let's follow up with that and make sure you have the full comprehensive knowledge of what's going on. The pain aside, that probably does not apply to most people listening here, the pain piece of it, the physical pain, but the actual tools that helped you. I do want to highlight those so that other folks who are wondering, okay, what should I do if I'm a few months in?
Yeah.
And I want you to also give advice to your former self, right? You were in this stage of, like you said, I'm looking for something that I can do. I want it to completely go away. Your wisdom now is a bit different. So there's people here who are listening who are perhaps in that earlier phase, whether it's on the 4 stages of habituation, phase 1 or phase 2. So share some of what you've learned, please.
Yeah, it's really all about my therapy. I had a son that I had to take out and tour the country. He was about to go off to college, so I was taking him to different schools when it had just started 3 months in. But I had to do that. So obviously, you do what you have to do. But it was tough, and I got through it because of the therapist at the time. Like I said, that I started with in the very, very beginning, because that's what people said. The best thing you can do right now is just settle down your anxiety and see a therapist. So my daughter's legally blind. She was starting high school. My son was starting college, and that's just about when this all happened. So the good part about it is you have to get through it, right? My CBT therapist, like we all know, we're not going to die. There's nothing wrong with us. We're going to be fine. That all sounds great, right? When you don't have tinnitus, but at the end of the day, it still affects us. But I think having a busy life at work and at home, and having to bring my son to 5 different colleges, and my daughter, we had to do some special needs stuff. It kept me busy, and I think that's the key to this. I feel bad for people that don't have busy lives and only have this to kind of concentrate on. But in the very beginning, it was all about the therapy and the breathing and just keeping busy. I mean, I just, and I still do, but it's not as bad. In the very beginning, I would do errands every day I was home. I worked from home 1 day a week. I would go, and I never do errands for my wife. Laundry, CVS, Walgreens, food shopping every Sunday. I did that for 6 months straight. Whenever I could get out of the house and do things, I was fine. As soon as I was by myself, I was my own worst enemy.
There's 2 sides to that coin, because yes, when you're staying busy, you're diverting your attention. Therefore, okay, tinnitus isn't bothering me because these other things are on my focus. But
I'm running from it.
But you're sort of keeping it's still there, really. It's still impacting you. What you touched on are the things that work the most might fall under the category of mindfulness, cognitive behavioral therapy, these things that actually get us out of the anxiety loop in our head and into settling the mind, settling the body through practices like guided breathing, or analyzing the thoughts and saying, oh, is that accurate? Is that true? And then through that process, the autonomic nervous system can regulate itself and settle down. And that sends a signal to the brain that's looking at and responding to tinnitus as a major threat, or is activating the fight or flight response, how it can send a signal of, actually, I'm safe, because when I'm doing this guided breathing, I'm noticing I'm more calm, I'm more at ease. Therefore, the sound of tinnitus isn't an actual threat in my environment. It's not actually harming me in this moment, because if I'm feeling calm and restored, then how can I be under an imminent danger or threat? So the brain learns through that process. Therefore, every time we do mindfulness, guided breathing, CBT strategies, healthy sleep routine, the brain is learning through conditioning. I'm actually safe. The imminent threat isn't as intense as I was reacting to. Any advice for folks who are trying to elicit that response? It's not always easy.
I could say I probably had 3 or 4 legitimate panic attacks when I first got it. I have a Fitbit watch that I wear. And there was a day that the tinnitus was so bad, I was getting nervous, and I was looking at my pulse rate, and it was like 97 or whatever. I was sitting at the computer, and I'm in okay shape, not great shape. And I have a friend at work, and he actually rushed me to one of the emergency rooms because I thought I was, maybe having a heart attack, or, I was getting elevated because it was almost at 100. And that was at rest. I was sitting there. So that was like a full-blown situation where you talked about fight or flight. Mm-hmm. I had about 2 or 3 more of those at different times. I was at my house at least, so I could relax. And through the CBT therapy and through the breathing and through the exercises, I don't get in any situations as bad as things have been. My son's at school, and some things have happened out at the school, and there's no more fight or flight. I don't get to the point where I feel like I'm not in control of my body, even when the tinnitus gets really bad and it's roaring. I know once I lay down and relax, I know it's going to come down.
Yeah, we're really glad to hear that.
Yeah.
So we're here in New York City. We're here in Manhattan. And earlier I saw that there was a group of us who were talking, and you were sharing some advice of what you've learned. In the spirit of that, for the group here and for those listening, what's something that you can provide to people in terms of your experience or your wisdom or things that you've learned that here, when we take a break, we'll be able to mingle and folks might come up to you and ask? And then also maybe one thing you're asking for help with, and that could be sleep based on what you said.
Correct. And like I said, I was always a control freak. I was the last person in the world that if they got this phenomenon that I call it, that would be like really, really bad thing for somebody like me to have, because I'm a control freak with my family, with the finances, with work, with everything that I do. And when this happened, it just kind of stopped me dead in my tracks. And I said those first couple of months, how can I get through it? I have a psychiatrist, so he helped me through a little bit in the beginning. But as of like 4 months ago, I don't need any meds during the day. It's only the sleep now. And I know during the day, as bad as things can get, I can get through it. The ear pain, it's just been very frustrating. And because I am a control type of personality, I want solutions. I want answers for everything. And this young lady over here in purple, we both said the same thing. So sure, you go to the doctor, I have it in my left ear, first thing, go for an MRI, acoustic neuroma. If it is 99% of them are benign, we'll take it out, you'll be fine. When I came back and got the results of the test and he said that I didn't have it, I was like, I was actually hoping that you said that I did. Because if you said that you could just go in and take this little thing out behind my ear that's been causing the ringing, I said, I'll sign up tomorrow at 8 a.m. for the first, surgery. Yeah.
That's one of the most important things that we provide. And I want everyone to have clarity on what is the root cause of their tinnitus as much as possible. There are some cases where we can't identify it. However, what I've learned is that the more specialized the audiologist or the ENT in tinnitus, we can say with high confidence, based on research data and our own day-to-day experience, of this is the cause or causes of your tinnitus. These are the physiological mechanisms of why things went badly. Here's what we can do through the same physiological systems and potentially treatments to help you. And that part does not go well for a personality type that needs control and needs to understand what caused it and what is going to fix the cause.
Especially when you've been to a lot of doctors and they all just say the same thing. We just can't get you there. We just can't figure it out. Or I haven't seen the right, audiologist yet. I don't know.
What's something that people can come up to you and ask for some help on? What's something that you feel like you've gotten down?
Definitely not sleep, but I can't help you there, but I can definitely help you with how it feels those first couple of months, especially if you're somebody that has a family and has children and has a lot of responsibilities in your life at work and at home. And the thought, how am I going to go home and how am I going to do this? How am I going to make dinner? How am I going to take care of my wife? Right? Like that's a lot of struggles. My wife and I, my therapist, had to help, me with that, right? Because unfortunately, she's the one that's taken not abuse, but obviously when we're really reared up, right, we don't really act or speak nicely to the people that we love. And I had a lot of problems with that, my wife and I, but we figured it out. But it was good that she stuck by me because I was a you-know-what those first 4 or 5 months, and it wasn't pretty. Not in front of the kids, but she unfortunately, took my bad days, and that's a really big thing. You got to really take care of your loved ones and just let them know what's going on. Unfortunately, my brother and my mom, they're kind of like me. They just want it to be over, and they want me to see doctors and it to be good, and they still don't understand that it's not going to, and they have to live with it. And they really couldn't. They couldn't understand my bad days. Why I would just say, I need to leave. Well, what do you mean? Where do you want to go? I just want to lay down for a half hour. I need to take a break. My wife understood that. But that's the important part, definitely, with the families. Yeah. It's tough in the beginning. It's very tough on your family to see you like that. But I did. The biggest thing is my therapist tell me, and I still believe in it, we're fine. It's not going to hurt us. Unfortunately, I have pain. I'm glad you guys don't. But it's nothing that can hurt us. We don't have pain. We're not going to die from it. It's not going to kill us. I know it still doesn't help a lot of you. It has helped me, though. Know that as bad as it's going to get, I'm still going to wake up the next day and be able to do what I need to do.
Let's give it up for Tom.
Thank you. Thank you.
Thank you so much.